top parent questions is like, will my child need teeth extracted for braces? What I usually explain is that sometimes no. The biggest thing here is that to prevent any permanent teeth impacted in the bone. So if needed, then we will remove baby teeth. But nowadays, as the patient is growing, like permanent teeth, we usually don't remove, only in very complex cases. But baby teeth, occasionally we need to remove to prevent any complex treatment in the future.
Can I ask, Alessandra, so the kind of traditional braces in Ireland years ago would have been extracting a lot of premolars and closing up all the gaps, whereas the American smiles were much broader. They were, they wouldn't have extracted the teeth as much. Is that correct?
Yeah. So in the past, premolars extraction was a very famous and most common treatment. Yeah. Nowadays, with development of orthodontics, we can use a lot of devices and treatments to open space to bring the permanent teeth or to align the permanent teeth, and also to prevent these premolars extraction.
So it's a broader smile and a nicer smile, really, at the end of the day.
Yeah, I think that nowadays the technique is more bringing more the smile wider, making it wider.
Roberts style.
yeah.
Great, sounds good.
And if it's the case, nowadays we prefer to remove wisdom teeth.
Okay.
Rather than the patient staying with the space here and closing. So it's another option. So we just go for premolars extraction nowadays if there is no other option.
Very severe. Okay, perfect.
Yeah. The other question is, how do I know if my child actually needs orthodontic treatment? So now I invite you to come to a consultation for the first assessment. As I covered before, if your child is 7 years old or more, you should bring the kid for the first consultation. Then we will assess. We will make all the exams, X-ray scans, and then I will build the treatment plan. Some patients, we don't need to do any intervention at the moment. And if it's the case, I usually ask the patients, the parents, to bring them every 6 months or every year. So we take an X-ray and we keep an eye, because sometimes as they are growing, things can change. So if you really want, keep an eye on the items that I said, how things that can caught your attention. But also the most important is bring your kid to a first consultation with the orthodontist.
Okay. Can I ask a question? I'm just wondering, what percentage of kids would you say don't need braces these days? I mean, it seems that a smile is so important. It's, what was a decent smile before is now considered suboptimal. I don't know anybody who doesn't get braces personally anymore. It's whereas years ago was kind of only for the worst cases, whereas now people want to have a perfect smile, for work, for life, for relationships. Do you have a percentage that across the board, or is it, just not that easy?
To be fair, I think that in the end, 90% of the patients will need braces or will need orthodontic intervention. Yeah. It's just about the time. Yeah. So there is a range, let's say from 7 to 10 years old, or at 9, 10 years old, that we will focus more in bone and make sure that we have room for the permanent teeth.
Yeah.
And if we have any bone issue, any bone problem, like upper and jaw, are not sitting good and nice, then we will be targeting this.
Okay.
After that, once they have permanent teeth, then we focus on the orthodontic treatment, aligning teeth, and that's this part, usually 90 to 95% will go for it. Yeah. But sometimes if the patients, they have a good bone relation, they have space for all the permanent teeth, we just do a follow-up to see if it's not going to change the scenario during the time.
Yeah.
But orthodontics nowadays is something that is almost
yeah.
So how can I monitor my child's progress during treatment? The first thing that I like to show parents is the scan that we do on the first consultation and the pictures. So they have day one comparison. The second thing is like, I like to take the OPGs new pictures. I like to send to parents so they can understand, look, the tooth in this x-ray, the teeth were like this, now they are in this position.
You did it for us. You did it for my daughter recently, which was great to see the movement of the tooth, you know. So it's nice as the parent to see that as well.
Yeah, so that's why like I like this scan. I like the x-ray, even if it's more technical. I like to show the parents, and after I explain, it makes a lot of sense to them. See, now we have room, this tooth is coming down. I think these are the most, and even pictures. I have parents that they say, I took a picture of my kid, and now I can see the difference even in pictures that we take.
Amazing.
Yeah. What happens if my child doesn't follow the treatment? So this is very important, not just following the treatment, but following the hygiene instructions and the dietary instructions as well. So the biggest thing is that the treatment will be delayed, and sometimes it delays like a lot. So we try to, every consultation, if the child is not following the treatment, I like to understand why the child is not following the treatment, what is going on, so we can make like the lifestyle to fit in the treatment. Because it's very important that the child likes the treatment, understands why we are treating. So the biggest thing here is that it will delay the treatment. So they need to be very careful on braces. Don't eat, as I said, hard food, avoiding like breaking the brackets or not wearing the aligners. And worst case scenario, sometimes there are patients that at that moment they are not ready for the treatment. This is something that we need to consider when we are building a treatment plan, and then we go for a second treatment in the future.
Okay.
And the last one is, does orthodontic treatment affect my child's sport or musical instruments? Thank God the answer is no. So even if they go for braces or for aligners, they will fit into the child's sports or musical instruments. But of course, if they play some specific sports, we recommend mouth guards to protect. Some musical instruments in the beginning, they could be a bit different, but it's the same as when we put the braces. It's just 1 or 2 days, and then it will be normal life.
Okay, that's great. So you've got a future up-and-coming rugby star. You can still play rugby and with the right.
Yeah, hopefully I am treating a lot of future rugby stars in Seapoint.
Sounds good.